Sift ingests and normalizes providers' clinical encoding and claims data to build a unified source of truth around their payments. This data foundation enables Sift to build predictive models that optimize revenue cycle workflows and payment outcomes. Sift's analytics and integrated machine learning equip providers to strategically engage with patients and better manage that payer reimbursement. At the end of the day, our platform works to accelerate cash flow, reduce write-offs, and improve patient payments while reducing the cost to collect. As Katya mentioned, I'm Justin Nicols. I'm the founder and CEO of Sift Healthcare. Sift is a data and analytics company focused on healthcare payments. We help healthcare systems optimize payment outcomes from both patients and payers by integrating machine learning workflows into the provider's existing rev cycle work queues. Revenue cycles are vital to healthcare delivery in the United States, but has become incredibly complex and challenging. It's contributing nearly toward 25% of our end healthcare costs through that total administrative burden of trying to collect payment from both patients and payers. Between declining reimbursements and growing patient financial responsibility and an increasing cost to collect through lower access to workforce in labor, healthcare providers are in the expensive position of having to spend more money to recoup fewer dollars. Fundamentally, healthcare providers have become lending institutions in that every day providers extend billions of dollars in credit in the form of care and have little idea if and when they will be paid. It has become essential that healthcare organizations approach their data and transactions like other well-developed industries where data management platforms and machine learning are widely deployed to optimize transactions. Healthcare providers need better tools to manage and leverage that payments data. Providers have invested millions into their EHRs and workflow systems and have Six Sigma'd everything, and have invested millions into their EHRs and workflow systems and have Six Sigma'd everything they can from an optimization perspective. They still don't fully understand what's going on in their data and how to turn what those analytics are showing them into action. Sift ingests and normalizes providers' clinical encoding and claims data to build a unified source of truth around their payments. This data foundation enables Sift to build predictive models that optimize revenue cycle workflows and payment outcomes. Sift's analytics and integrated machine learning equip providers to strategically engage with patients and better manage that payer reimbursement. At the end of the day, our platform works to accelerate cash flow, reduce write-offs, and improve patient payments while reducing the cost to collect. As patients increasingly become responsible for a larger portion of their healthcare costs, they expect a more consumer-driven experience and are very often in need of flexible payment options. Sift helps providers respond to this new reality by equipping them to proactively address the financial needs of each patient individually. We build machine learning models that identify which patients are likely to pay their bills, when they're likely to pay, and the best fit payment plan for each patient, and the most effective contact strategy for each one of those patients. This intelligence optimizes the patient's financial front door, enabling providers to strategically leverage their EHR tools to communicate with patients at the right time, in the right channel, and with the right message with the right payment option. For our clients, this approach maximizes payments, reduces cost to collect, and works to establish stronger patient relationships. Sift's payment intelligence platform also provides holistic optimization of payer payments. Through the combination of clinical coding and claims data, our machine learning identifies which claims are likely to be denied by payers and preemptively provides recommendations and edits to prevent those denials. On the back end, we identify which denials have the highest ROI and likelihood of being overturned, as well as to whom each denial should be assigned. Sift automatically prioritizes denial work queues and drives denial insights upstream to predict the likelihood of denial in CDI encoding workflows and provides actionable intelligence to functional teams to mitigate the root causes of those denials. By enabling a constant feedback loop, Sift reduces both the likelihood a claim will be denied and makes denials management efforts more efficient and effective. We also believe that the combination of both clinical coding and claims data will be critical for providers and payers as they look towards new and more efficient reimbursement models like value-based care and auto adjudication. Sift works with large healthcare systems by targeting providers who have a minimum of at least $500 million in annual net patient revenue. For those clients in phase one of our deployment, we're delivering around $5 to $6 million in value between reduced write-offs and increased payments. Our business model is AI as a service, which is enterprise contracts that have recurring monthly fees based on patient account or claim volume. And as we continue to provide value to our clients and build out the platform, we expect to broaden the scope of our analytics and services we provide. We've grown tremendously over the last year. We're currently working with 7 industry-leading health systems across the country with our denials product. And through a large revenue cycle management partner, we're driving patient payment plan and contact strategies for 46 major health systems across the country. We also have pending partnerships with 2 leading CDI encoding platforms, which will enable us to power intelligence into the middle revenue cycle. We're currently doing about $2.2 million in run rate in terms of annual contract value. We've got about $4 million in immediate pipeline behind that. We're currently raising a Series A round, targeting between $6 to $10 million in a price round. Historically, we've raised about $8.5 million. We're looking to close this in either late June or early July. And I look forward to receiving your questions. And if you have any questions beyond this meeting, please feel free to reach out.
Where do you see the most interest from clients and targets? Patient payments or insurance denials? Share a little on that.
Yeah, it's I would say the immediate interest is certainly around denials, particularly around clinical denials in the middle revenue cycle. Increasingly, reimbursement is becoming complex, particularly with the changes in Medicare Advantage plans and reimbursements and contracts related to those. Increasingly, though, we are also seeing engagement from providers as you're seeing more native patient communication technology being built out into the EHR. And increasingly with price transparency laws and the no surprise billing law, providers are wanting to and engaging and need to engage with patients sooner about their bills. So increasingly, I think over time, you'll see a balance of both interest on the patient financial front door as well as the clinical denials.
And on the clinical denials, can you share a little about your machine learning and how it works to prevent those?
Yeah, certainly. So it's first and foremost, what our team is very, very good at is data normalization. So these data sets really live in disparate systems now. Our head of analytics is the former vice president of insurance claims analytics at LexisNexis. So we're very, very good at combining clinical encoding data with payment data to build a full longitudinal view of that encounter. So you know what was rendered, what was charted, what was coded, what was submitted to the payer and what the payer respond with. What that allows you then to do on the go forward is predict denials while CDI or coding is taking place. And not only predicting the likelihood of that denial, but also then providing the number one indicators in that data set while CDI is taking place or coding is taking place. That's saying these are the contributing fields in that data that make it most likely to deny. So you can either further review that with additional documentation or review with the physician or payer contracting, or just know that that claim is not going to get paid sooner in the process.
Makes a lot of sense. One topic that comes up a lot with solutions like yours and just in our space in general is physician burnout. Can imagine that you guys play a nice role there. Can you talk a bit about that?
Yeah, no, it's a great point. Increasingly, you see providers needing to kind of do rework on work they've already done, right? You've already charted this, you've already documented it, and you need to come back and kind of restate your case to the payer. So again, being able to predict that likelihood of denial while dictation is taking place or CDI is taking place really makes it the most effective use of that physician time to hopefully make it only so that they're working once rather than this kind of repeat process of a vicious cycle.